Okay, so this session will be recorded today. It will be recorded today. None of your faces will be shown, only your voices will be heard. If you have any objections, please let me know. And that goes for those of you on Zoom as well. And Dr. McNally.
Oh, okay. So scoliosis is the title of this talk with diagnosis and treatment. Basically, the diagnosis is just off a physical exam. The doctor can tell by looking at you if it's other than mild scoliosis by your shoulders and the curvature in your back. But x-rays is the real way to confirm that you have scoliosis. The three pictures up here, the one on the left is a normal spine, what it looks like, nice and straight. The one in the middle is has a curve in the kind of the junction between the ribs and the lower back. And then the one on the far right is the one where the person's had surgery before. So very few people actually need to go on and have surgery for scoliosis. What happens more commonly is that there can be some lumbar spinal stenosis associated with the curve in the spine. And what this is trying to show you is on the left, there's a normal spine and there's a space for nerves. And then on the right, there can be either overgrowth of the joints or, which is right here, there's the joint on the right side that is overgrown and has arthritis. The one on the left side is normal, but here's a disc herniation pinching this nerve. Here, the bone spur is pinching a nerve. So stenosis just means any kind of narrowing in the body. And in this case, it's the lumbar spinal stenosis. So what happens is things can kind of wear out over time. And right along with scoliosis is another fancy word, spondylolisthesis. And what that means is a slippage of the bones. So on the left, the bone is normal. On the right, there's some pinched nerve because the bone is shifting forward. And what happens when you have stenosis, whether it's from scoliosis or spondylolisthesis or just overgrowth of the joints or the tissues in a regular spine, is people usually get leg pain or a difficulty walking distances. And so that when they stand up, the woman on the left is standing up and the nerves being pinched, and it gets a little bit better if you're leaning on a shopping cart or a walker, and then it usually goes away if it's from stenosis when you sit down. So this is just trying to show a normal vertebra in disc at the top on the right, and then it's getting a little bit of wear and tear where the disc wears out and there's some arthritis in the joints. And you can see the difference between a normal joint with a healthy white cartilage, just a little bit of fluid, versus the inflamed arthritic joints in the back. Those are called the facets in the back of our spine. So people can have scoliosis without any pain, or some people can have scoliosis with a lot of pain. And so our typical treatment for scoliosis is different when we're talking about skeletally mature people. So people, girls after age 14 or boys after age 16 is different than the juvenile or idiopathic scoliosis, where we try to brace it if you're still growing. But if you're already done growing, and again, girls stop at 14, boys at about 16, then it's adult scoliosis and it's degenerative. And usually we treat it with rest or changing their activity, losing a little bit of weight, medications. You can try some chiropractic care or massage or even acupuncture in physical therapy or injections. And then that's basically what the bottom part of the slide is talking about. There's anti-inflammatories. We try to avoid opioids because of the risk of addiction, but sometimes different medicines help, and the primary care doctors are usually pretty good at prescribing those. And physical therapy is good because it teaches patients how to treat their own symptoms. So when they're having difficulty with something, they can work with their therapist. I kind of view therapists as coaches. You tell the physical therapist what you want or need to do, and they'll try to help you figure out how to get that done. And then pain doctors can help too if medicines and physical therapy and rest aren't changing it. So usually we go a long way before you get to a surgeon, but you start with your primary care doctor and all those options I just talked about, the pain management doctors, and sometimes it gets on to the point where you need surgery. But in older people, kind of over 75, if they have really bad scoliosis, surgery isn't sometimes an option because the surgery to fix it is pretty major surgery and it puts a lot of stress on the body. So usually we try to catch it before you get too late into your, before you're too old. But when we do surgery, we try to correct all the different things that are wrong. This patient on the left, the x-ray shows that it's pretty mild scoliosis, but what one of the issues is one of the bones kind of shifted out and went off to the side. And then there's also, if you look at the next slide over, there's got an L on it. It's showing how the patient was kind of stuck bent forward. And we ended up doing surgery where we put something in between to straighten her out and then held it in place with the rods and screws. So you can tell by looking just at the x-rays that that's pretty major surgery. But the good news is that we're getting better and better at it with nowadays we have computers and robots where we can get a CT scan and that puts an image that we can use and take into the computer, and we can use our surgical planning and make sure that our screws are in a safe trajectory. And then the computer tells the robot where to move so that we can then follow that and put in screws safely. So basically, scoliosis, it means a curvature of the spine, and it usually doesn't happen by itself. In young, it happens in girls more often than boys with idiopathic scoliosis. That is in young people, and that's kind of the only thing going on. In older people, when you have scoliosis, there's usually a certain amount of arthritis or degenerative changes that goes along with it. And then besides the curvature and the S shape for scoliosis, the S shape, there's also usually some changes with the ribs turning and also with the bones kind of shifting out of place. So depending on what the symptoms are, diagnosis is pretty straightforward. The doctors can tell just by looking at you and examining you, and then also x-rays makes it. And then depending on what those are and your response to medicines, therapy, et cetera, sometimes people get MRIs, some people get injections. And when all of that fails, we do a risk benefit assessment as to whether surgery would be indicated.
Maybe I missed that. So, which type of diagnosis?
No, you start with the primary care doctor usually. And then the primary care doctors. So it used to be, I don't know if COVID's changed it all because it's changed the whole world. It used to be back pain was the second most common reason that someone would go to their primary care doctors after upper respiratory tract infections. So primary care doctors are very used to dealing with back pain. And then often with that, and if it's mild scoliosis, you might find it with an x-ray or things like that.
Okay, I know I have scoliosis. So if I go to my primary, they'll go, yeah, you've got scoliosis. So step number two?
It depends on whether it's bothering you or not. So if it's leading to some kind of pain with stenosis or pinched nerve and it's stopping you from walking distances and things, then the primary care doctor would probably start just kind of with medicines and physical therapy. And if that's not helping, then often an MRI and then pain management.
McNally?
Yes.
My name is Shirley McNally. My question is this: what research is being done on scoliosis with hemp, CBD, essential oils, or with marijuana, medical marijuana?
I don't know all the specifics of that. As far as the specific research for it, but there are, as CBD and marijuana has become more common. Again, a lot of this was happening before COVID, and it seemed like it was just like everything in medicine, started out being a miracle drug, and all the news shows were talking about it. They're starting to find out now that marijuana isn't be all and end all, and that there's risks associated with it. So it does work for some people. in my practice, because I'm a surgeon, mine is mostly rods and screws and scalpels as far as treating, not medicines.
Right, basically, because we cannot recommend that they do research on it with the hemp. It doesn't have to necessarily be marijuana. Medical marijuana could be the actual hemp or the CBD part of it.
There could be, and there might be someone working on it.
Okay.
That, they'd have to apply for a grant and get the research and things like that to get the money to do the study.
So you would be the person I can come to first, right? If I want.
About marijuana?
Well, no, about CBD, about the hemp, and I can come to you. You recommend me to go to whoever the research person would be.
Actually, I don't know who the doctors are that use that, because it's often not regular MDs that like me or DOs that are, that we think of as a typical doctor. Sometimes they work kind of outside that, just because it's not legal in the US yet, and most of our drug enforcement agencies, so our ability to write prescriptions are tied to the federal government.
Yeah.
So most of us don't prescribe marijuana for that reason.
Well, I just wanted to know if you had any connections so I could go to that research person. Okay.
I don't know of any. My nurse used to know of some websites.
Oh, good. Thank you.
So for scoliosis, starting off as say a youngster, would proper position or sitting help to alleviate or?
It actually, most of the study doesn't, they talk about a little bit of physical therapy, but as far as just being more flexible and stronger, because the better our muscles are, the better they can help us with the posture. So I already threw out the scoliosis, which is the S-shaped curve. Spondylolisthesis is the shift. The other one, it doesn't work in older people, but there's a thing called kyphosis, where you can get kind of a sharp angle in your back. And some of that in teenagers is positional, and then posture does help with that. But by the time we're skeletally mature and into our 30s, 40s, 50s, we're too stiff for that to make a difference as far as the scoliosis. And that just reminded me of a cute story. One of my mentors was a spine surgeon, Dr. Gupta. He was here for a long time, but his little girl, whenever this was, there was the Hunchback of Notre Dame, came out from Disney, and someone was asking her about it, and she just said, "Oh, he has kyphoscoliosis. Don't call him Hunchback."
That is so cute.
Yep.
That's a good.
Now, I had a stroke in 2013, and my shoulder has a tendency to go down, and so I remember to bring it back up so I don't end up lopsided.
Mhm.
Does that affect your spine?
It can, but again, most of the time it's affecting the posture a little bit, but it shouldn't cause it to be curved.
How is I've been told I have a sciatic nerve.
So that goes into the pinch nerve. So the different nerves coming out of the lumbar spine, they come out and they're numbered L1 through L5, and they cross over and they become the sciatic nerve that leaves the spine and goes right behind the hip. So when people call sciatica, that's the same thing as radicular pain or like pinch nerve pain.
What can you do for it? Just stretch it out or?
So that's usually the way it starts. Primary care doctors are really good at taking care of it with medicine, physical therapy. If that's not working, then they do the MRI and then a pain doctor. And then if even that doesn't work, that's when in surgery, we go in there and take the pressure off that nerve root. So if it's one nerve, we don't have to do the big surgery like I was showing you with all the rods and screws. We just do a opening up more like a carpal tunnel, which is a tiny incision just to take the pressure off the nerve when it's not associated with scoliosis.
I have a question.
Mhm.
My mother has got. She has constant. And she walks for this side of both legs. She's got strong walking.
That is typically from pinch nerve. And so that when we, So there's a couple of things, and that's why where doctors come into it, because by exam and things like that, they can figure out. But when we stand up, the bones, we get the curve in the small of our back. And what that does is it sometimes can put more pressure on the nerves. So you can walk a certain distance, and that's when you get the pain in the hips. And so that's often why I've had lots of patients where like older gentlemen say, everybody in the parking lot thinks I'm so nice because I grab their carts from them, but he takes their carts because he likes leaning on them and he can walk better. So when we lean forward, we open things up a little bit. So your mother, it could be bursitis over the hips, but it sounds more like it's pinched nerve.
A question from chat. What about wearing a brace part-time along with physical therapy?
So speaking of scoliosis, when you're still growing is like I usually slip and say little girls because it's girls outnumber boys 5-1. So when you're growing, a brace is kind of like braces on the teeth or like a rope to try to get a tree to grow straight. But once you're done growing, a brace won't change scoliosis. But we still use them not to treat the scoliosis, but sometimes just to kind of support people if something got inflamed a little bit. Like this is trying to show an inflamed facet joint in the back of our spine. Just like sometimes when people have knee pain, just putting a knee sleeve on, making it warmer, kind of brings more blood to help it kind of heal or settle down. Sorry. So the preventative measures are just like they are for our general health. Not so much scoliosis, but in general, back pain, the more fit we are, so the more exercise and activity and the better our heart and lungs are, the better it is for our back. And the same thing as we get older, if you did have scoliosis and it needed surgery, the more fit you are, usually the stronger your bones are, and that would hold our screws better. So sometimes people have bones that are so thin that we can't do the rods and screws because they would just kind of pull out of it like drywall as opposed to a nice hard piece of wood. I can't remember the order.
What is the facet?
The facet joint is sorry, I forgot about the camera. The facet joint is in the back of the spine where I'm kind of pointing with this little arrow that's moving around. And then this is a blow up of it. And the facet joints are joints in the back of the spine.
I know you say it's a degenerative process, but once your spine or your the alignment is off, pretty much continue down the hill, or can you stop the process? Is there anything you can do to help yourself at that point, or once you have stenosis, it's only gonna get worse?
No, not necessarily. So like we can't tell, sometimes we get x-rays or MRIs over a span of months to years so that we can tell whether something's getting worse or not. But often, I mean, our bodies were designed to stabilize and not have surgery and things like that. So what happens is when you look at the example we have over here, when you have a normal lumbar disc, there's a lot of motion at that level. But when the disc starts wearing out and the joints get arthritic, they get stiffer. So sometimes our getting stiffer is kind of protective so that it stops the scoliosis from continuing to get worse, but it also stops it from hurting so much.
So I've had some pains that lasted a couple of minutes, and I thought this would be like for the rest of my life. And then somehow it all goes through here. So I don't know if I did something right, or my body did something right, or what's going on.
It's most likely your body. I often have patients that have gone through that whole pyramid that we just talked about, where they started with their primary care doctors, then they got physical therapy, injections, medicines, and all that. And then they're still having symptoms. And we talk about it because they ask me, well, what happens if I do nothing? And if the answer is, and I usually turn it around, I say, well, what's been happening? Well, they say, well, I've been working on this for 5 years. It just keeps getting worse. my answer is probably going to keep getting worse. But if they tell me I made this appointment 6 weeks ago and now I'm feeling great, I'm not operating on them usually because they're getting better on their own. And we can't tell often by looking at one MRI or one X-ray who's going to get better, who's not. It kind of depends on who responds to the different treatments.
One last question.
Sure.
You mentioned physical therapy there. Are there people that specialize in scoliosis physical therapy or any physical therapist?
Pretty much any physical therapist, because the physical therapists are just like, the different doctors, where we know what we're expert in what we're not, and we also know how to find someone who can help. So most physical therapists are very well adept at taking care of it, again, because back pain and things are a very common reason to see the primary care doctor, but also to see a physical therapist. All right. Okay. Thank you guys for coming.
Thank you. I don't think there are any other questions. Thank you, Dr. McNally.
You're very welcome.
Did you all have any further questions?
Does yoga help with this problem?
We just left.
I would think any kind of exercise.
Did you have this online? I could have watched it from home.